Hi, my name is Tom Denchy, and I'm retired from the Air Force. And I was having problems with my teeth. I had a full lower, and it was flopping around. I've had it for quite a while. I was hammering my jawbone down to the point where there was nothing there to hold it in anymore. And the last time I had my plate redone, when they came back from the lab, they tried putting a whole bunch of stuff on it. I really had a mouthful of stuff to try to hold it in place, and they told me I had to figure I'm going to need implants or they're not going to be able to put any teeth in. So I went looking for a place to have implants put in. So as I went looking, my thing, and I guess Dr. Steinberg was surprised when he asked me, if I had any apprehensions, and that's what it was. Well, he was the only one that explained to me his process and how he could see where the nerves were and that he could make sure that he didn't hit a nerve, and that he had so far up to that point 100% success with the implants. I guess the first thing when I came into the office and came in for him to, I don't know what you want to call it, where he checks your teeth and all this stuff to see what you have, was the cooperation between all the members of his staff. And the atmosphere was also a big selling point to me. He also was the first one that would explain to me what he was going to do to try to make sure that he did not hit a nerve. With the rest of them, it was just a guess as to where my nerves would be, and I wasn't going to take that chance. So I really enjoyed talking with him, and then I went through the process of having, I guess it's a CAT scan done of my jaw, and then he tried to spend quite a bit of time trying to figure out where he could put the implants. And I guess I've always been a guinea pig for something that never worked out, especially in the service. But he said that he had a rough time trying to pick this places. So he did. He picked 6, knowing that if all 6 didn't work, that 4 would work. And I thought, I was really impressed with him and the way he was so particular about everything. He was worried about my smile, and I wasn't, because I hadn't smiled for quite a while. And well, I was used to smiling with my lip holding my teeth in place so that they wouldn't flop, So it wasn't a concern to me, but it was to him. And now that I have teeth that stay where they're supposed to, I guess it is, I do smile once in a while without holding them in with my lips. And I've become very cognizant of this fact. When you see people on TV and they smile and they're like this or like this, I know exactly why they're doing it, because I've been there. And I guess I can't really say how much it means to me to be able to eat and bite things without the pain that I had before, that I don't have to eat everything that's soft. It's nice to eat crunchy stuff, and I'm a snackaholic anyway, and it has made quite a difference for me and has made my life a lot happier. However, I am getting a little bit of a gut from eating all this stuff. Other than that, I can't say enough about Dr. Steinberg and his staff and the way I've been treated here. It's almost, I don't know, I don't want to say treated like royalty, but sort of like, they come in and I said, gee, I wonder if they treat everybody that way or it's just me. I like to think it's just me, but if you're sitting here and someone else comes in, they all get that same treatment. And it's really, it made what could have been a horrible experience, you know, very nice, and with a great, you know, ending that I'm very happy, and anyone could even call me, because I can talk now without being like, you know, holding my teeth in place. It's just changed my life completely, because I feel, I don't know how to explain it. If you haven't had it happen to you, you don't know, you won't understand it. But it has increased my my self-esteem, I guess I might say. Wherever I go, I can open my mouth and say what I want to say without sitting there and thinking, you know, are they going to notice? Because it got so bad that it was obvious to me myself that I was holding my teeth in place with my bottom lip.